From the great state of Arkansas, Tom Cotton. Senator, good morning to you. What can you tell us about what it sounds like is the deal that was reached between the Republicans and the Democrats in the Senate about 1:30 last night?
Hey, Steve, I'm glad that the Senate Democrats finally took yes for an answer. I want to be very clear, this is not the bill that Nancy Pelosi proposed earlier this week with lots of extraneous measures. What happened last night is the bill that Senator McConnell and Republicans proposed several days ago is now going to pass into law with some more money, which I've said we probably needed, regrettably, for things like unemployment insurance for people who are losing their job because of this pandemic, for more medical emergency equipment for our docs and our nurses, as well as for cities and states that are bearing the brunt of a lot of this pandemic, and of course hospitals too. So the bill will be very similar to what we proposed a few days ago, but with some more money that is regrettably going to be necessary to respond to this crisis and help keep our people safe and ultimately get our economy back on its feet.
It sounds like some of the details, Senator, are $1,200 checks would go to most adults, $500 to most American children. Workers would get more unemployment insurance and an extra $600 a week for 4 months on top of state unemployment. Let's talk a little bit about your state. You know, we're in the New York City area. You're down in the Washington, D.C. area. These are being impacted significantly, New York more than D.C. But what about Arkansas? How do the people of Arkansas feel about the COVID-19, spreading across the country?
Steve, Arkansans are very worried about it. They're very worried about what it means for our public health. They're very worried about what it means for our economy as well. We're up over 100 cases now. Unfortunately, I think that'll probably grow as more and more testing occurs in Arkansas, as it's occurring all across the country. Our schools are shut down, so that means a lot of our workers are home with kids because they don't have childcare, and unfortunately a lot of our small businesses are shutting down as well. I've been hearing from business owners across Arkansas for the last several days why the Senate Democrats dithered with this legislation, asking if it was going to pass today because they were going to have to start laying off workers tomorrow because they literally have no customers coming in the door. They have no cash with which to make payroll. So I want to say to them, I really want to say to workers and businesses all across the country, just hang on there for a few more days. Help is on the way as soon as this bill passes. I suspect it'll pass the Senate later today and maybe be signed by the president as early as tomorrow.
Well, that would be great. And the reason I asked about Arkansas was because yesterday the president did reveal in the Fox town hall, virtual town hall, that he would like to see America reopen, perhaps in stages, starting around Easter. How do you feel about that?
Well, I'd love to see that as well, but I think we have to exercise caution, Steve. The one thing we don't want to see is a relaxing of some of the restrictions on public activities and then a resurgence of the pandemic. Ultimately, this is going to be a multifaceted response. It's going to require more testing and more personal protective equipment for our doctors and our nurses, making sure that none of our hospitals, whether it's in rural Arkansas or in New York City, are overwhelmed, not just by coronavirus cases, but by other cases needing intensive care. And then also taking assessment of conditions on a regional, even local basis. Now, remember, the president didn't, quote unquote, shut down the country. These are decisions that are being made by governors and by mayors at the local and the state level based on conditions in their states. And ultimately, I think whenever we get back on our feet, get back to work, it's going to happen on a rolling basis in places that haven't had a large outbreak or have got an outbreak under control. So you won't just see a single nationwide set of conditions. I think you'll see it down to the local and state level as the president and the federal government works with our governors and our mayors.
Right. Real quickly, Senator, you wrote with Congressman Gallagher an item that's on FoxNews.com. It's an op-ed talking about how we are just learning how much of our capacity China has, whether it is prescription drugs or personal protective equipment and things like that. We've got to take it back. Quickly, your answer.
Yeah, things like antibiotics and ibuprofen and Advil are made in China for the most part. It's time to bring that manufacturing capacity back to the United States. It's time to bring a lot more back to the United States from China. China unleashed this plague on the world, and there will be a reckoning when we're on the backside of it.
All right, let's see what happens. Tom Cotton joining us from the D.C. area. Sir, thank you very much. Meanwhile,